Meningitis often begins with symptoms that sound familiar: fever, headache, nausea, vomiting, and feeling seriously unwell. But what makes meningitis different is where the problem is happening. The brain and spinal cord are wrapped in protective membranes called the meninges. These layers help shield the central nervous system and contain the fluid that cushions it. When those membranes become inflamed, the body is no longer dealing with an ordinary infection or a simple headache. It is reacting in a space directly surrounding the brain and spinal cord. That is why meningitis is treated as a medical emergency. The danger is not just pain or fever. The danger is inflammation close to the structures that control consciousness, movement, hearing, memory, breathing, and survival. The term meningitis means inflammation of the meninges. That definition is short, but the condition itself has many possible causes. Viruses can cause it, and some viral cases are milder than bacterial ones. Bacteria can cause it too, and bacterial meningitis can become life-threatening very quickly. Fungi and parasites are less common causes, but they can be serious, especially in people with weakened immune systems. There are also non-infectious forms. Cancer, bleeding around the brain, inflammatory diseases such as sarcoidosis, and certain medications can all irritate the meninges. So meningitis is not one single disease with one single pathway. It is a dangerous pattern of inflammation in a critical location, and the cause determines treatment, contagiousness, and risk. The classic signs of meningitis are fever, intense headache, vomiting, and neck stiffness. Neck stiffness matters because inflamed meninges can become painfully sensitive when the head and spine move. Some people also develop photophobia, meaning light becomes difficult to tolerate, or they find normal sounds unusually distressing. Nausea, confusion, drowsiness, or altered consciousness may appear as the illness affects the nervous system more deeply. The challenge is that early meningitis can resemble flu, migraine, food poisoning, or another common infection. That is why combinations of symptoms are important. A severe headache with fever and a stiff neck should never be casually dismissed, especially if the person is getting worse, becoming confused, or struggling to stay awake. In babies and young children, meningitis can be harder to spot because they may not be able to describe a headache, stiff neck, or sensitivity to light. Instead, the signs may look vague: unusual irritability, drowsiness, poor feeding, limpness, or being difficult to wake. A child may cry in a way that feels abnormal or seem unlike themselves. This is one reason meningitis can be so dangerous in young children. Waiting for adult-style symptoms can delay care. A rash can also appear in some cases, especially with certain bacterial infections. A particularly concerning rash is non-blanching, meaning it does not fade when pressure is applied with something clear, like a glass. Fever with that kind of rash is an emergency warning sign. Bacterial meningitis is feared because of how fast it can progress. Bacteria may enter the bloodstream or spread from nearby infections, then reach the membranes around the brain and spinal cord. Once there, the immune system responds aggressively. That response is meant to fight infection, but inside the skull and spinal canal, inflammation can cause serious harm. Blood vessels may become irritated. Pressure can rise. The flow of cerebrospinal fluid can be disrupted. Delays in treatment can increase the risk of deafness, seizures, hydrocephalus, cognitive problems, or death. With appropriate care, the risk of death from bacterial meningitis can fall greatly, but that depends on fast recognition and fast treatment. In meningitis, time is part of the medicine. Different types of meningitis can look similar at first, but they do not all behave the same way. Viral meningitis is often less severe than bacterial meningitis and may improve with supportive care, depending on the virus and the patient. But it still needs medical evaluation because symptoms overlap with more dangerous forms. Fungal meningitis is less common and can require long, specialized treatment. Parasitic meningitis is rare, but possible. Non-infectious meningitis may come from cancer, bleeding, autoimmune inflammation, or drugs. This variety is why doctors cannot safely identify the cause by symptoms alone. The body may show the same alarm signals for very different reasons, so guessing is risky. Urgent investigation is the safer path. One of the most important diagnostic tools is the lumbar puncture, also called a spinal tap. During this procedure, a needle is placed into the lower back to collect cerebrospinal fluid, or CSF, from the spinal canal. This fluid surrounds the brain and spinal cord, so it can reveal what is happening in that protected space. Doctors may examine the fluid for white blood cells, protein, glucose levels, bacteria, viruses, or other clues. The purpose is not only to confirm meningitis. It is to understand what kind of meningitis may be present and which treatment is needed. In some situations, scans or other tests may come first, but CSF analysis remains central because it gives direct evidence from the nervous system environment. Treatment often begins before every test result has returned. That is because waiting can be dangerous if bacterial meningitis is possible. Doctors may start broad-spectrum antibiotics quickly, then adjust them once the specific organism is identified. If a viral cause such as herpes is a concern, antiviral medication may be added. Corticosteroids can be used in some cases to reduce damaging inflammation and lower the chance of complications, including hearing problems in certain bacterial infections. Supportive care is also essential. Patients may need careful management of fluids, fever, seizures, blood pressure, breathing, and consciousness. Treating meningitis is not just killing a germ. It is controlling infection, calming harmful inflammation, and protecting the brain from secondary damage. Prevention has changed the story of meningitis. Vaccines can reduce the risk of several major causes, including meningococcal disease, pneumococcal disease, HIV infection, and mumps. These vaccines do not prevent every case because meningitis has many possible causes, but they dramatically reduce the danger from some of the most important ones. Vaccination also helps protect communities by lowering transmission. In certain cases, people who have had significant close exposure to someone with specific bacterial meningitis may be given preventive antibiotics. This is not necessary for every type, but it can stop spread when the organism is known to move through close contact. Prevention matters because meningitis can outrun hesitation. The safest case is the one that never starts. Meningitis is also a global public health problem. In 2019, about 7.7 million people worldwide were diagnosed with meningitis, and around 236,000 died. That death toll was lower than in 1990, when estimated deaths were about 433,000, showing that vaccination, medical care, surveillance, and public health systems have made real progress. But the burden remains serious. Bacterial meningitis outbreaks occur especially in parts of sub-Saharan Africa known as the meningitis belt, often between December and June. Smaller outbreaks can happen elsewhere, particularly where conditions help infections spread. This means meningitis is both an individual emergency and a community issue. Fast diagnosis helps one patient, while prevention and outbreak control protect many others. The long-term effects of meningitis are another reason urgent care matters. Many people recover, but some survivors are left with deafness, epilepsy, hydrocephalus, memory problems, learning difficulties, or other cognitive deficits. These complications can develop when inflammation damages delicate tissues, affects blood flow, injures nerves, or disrupts the normal circulation of cerebrospinal fluid. The risk is often higher when treatment is delayed or when the infection is especially aggressive. This is why doctors take suspected meningitis seriously even before they know the final cause. The goal is not only to keep someone alive during the emergency. It is to preserve hearing, thinking, independence, communication, and quality of life after the infection is gone. The practical takeaway is clear. Most headaches and fevers are not meningitis, but certain warning signs should trigger immediate medical attention. Fever with a severe headache, stiff neck, repeated vomiting, confusion, extreme drowsiness, seizures, sensitivity to light, or a non-blanching rash should not be watched casually at home. In babies and young children, unusual irritability, poor feeding, limpness, or difficulty waking can be just as concerning as adult symptoms. Meningitis can be caused by many things, and not every case has the same severity, but the dangerous forms move quickly. Early action gives doctors the best chance to diagnose the cause, start the right treatment, prevent complications, and save a life. If you found this helpful, please like this video and subscribe for more explainers.